There is a quiet fear that lives deep inside the human body, a fear we rarely name out loud, because to name it would make it real, and yet every single day, without dramatic warning, without flashing lights or sudden collapse, something vital inside thousands of people begins to slow down, to struggle, to fall silent, and they don't even realize it until life itself feels different in a way they cannot explain. Kidney failure is not the kind of threat that always announces itself with chaos. It can move like a shadow, subtle and patient, changing the rhythm of your days so gradually that you blame stress, age, or exhaustion instead of asking the harder question, what if something essential inside me is quietly shutting down? Imagine waking up one morning feeling slightly off, not sick enough to panic, not healthy enough to ignore it, brushing it aside because life is busy, responsibilities are heavy, and there is no time to worry about something invisible. But what if that invisible shift is not random? What if, at this very moment, your body is fighting a battle you cannot feel, filtering, balancing, cleansing, working tirelessly in silence, until one day it can't keep up anymore? The terrifying truth is that when this condition advances, it does not just inconvenience you, it changes everything: your energy, your independence, your future, your sense of control. It can turn ordinary routines into exhausting challenges and simple plans into uncertain questions. And the most chilling part? Many people who eventually face it once believed it could never happen to them. They thought they were too young, too careful, too fine. They ignored the whispers because there were no screams. We trust our bodies to alert us loudly when something is wrong, but not all dangers shout. Some wait, some erode. Some quietly rewrite your reality while you scroll on your phone, go to work, laugh with friends, completely unaware that the system keeping you alive every second is under strain. Think about how much of your life depends on what you cannot see. Tiny processes happening in the background, faithfully, relentlessly. Now imagine if that faithfulness begins to falter. Imagine discovering too late that the warning signs were there, soft and easy to dismiss, hidden in plain sight. It's unsettling, isn't it? The idea that the line between "I'm okay" and "something is seriously wrong" can be thinner than we ever imagined. This isn't meant to frighten you without reason. It's meant to wake you up to the possibility that your body may be communicating in ways you haven't fully listened to yet. Because when this condition reaches a critical point, it doesn't just ask for your attention, it demands it. It demands time, sacrifice, adaptation, strength you didn't know you would need. And once you cross that threshold, life rarely looks the same again. So before you brush this off, before you assume this message is for someone else, pause for a moment and ask yourself honestly, have I been ignoring subtle changes, quiet fatigue, unexplained shifts that don't quite make sense? What if this is the conversation your body has been trying to have with you all along? Stay with me, because what you are about to learn could change the way you see your health and possibly protect the life you take for granted every single day. When we talk about this condition, I want you to first understand what it truly means in the simplest way possible. Inside your body, there are two small organs shaped like beans, quietly working every minute of every day to clean your blood, balance fluids, and remove waste that your body no longer needs. You don't feel them working, you don't have to remind them. They simply do their job faithfully, like silent guardians of your internal balance. Now, this disease begins when those guardians start to lose their strength. Kidney failure does not mean the kidneys suddenly stop in one dramatic moment. Most of the time, it is a gradual loss of function. It is a slow decline where these vital organs can no longer filter the blood the way they are meant to. Imagine a water filter in your home. When it is new, the water flows clean and clear. But over time, if the filter becomes clogged and worn out, the water passing through is no longer purified properly. In a similar way, when the kidneys begin to fail, waste and extra fluid can start to build up inside the body instead of being removed. This buildup can quietly affect many other parts of your health because the kidneys are deeply connected to your heart, your blood pressure, your bones, and even your energy levels. That is why this condition is not just about one organ. It is about the balance of your entire body. Some people experience a sudden and severe decline in kidney function, which can happen over days or weeks. Others go through a slow process that develops over months or even years without realizing it. And that is what makes it so concerning, because the body is very good at adjusting. You might not notice anything unusual in the beginning. You may feel a little tired or a little different, and you tell yourself it's just stress or age. Meanwhile, the kidneys are working harder and harder to keep up, even as their ability decreases. Over time, if they can no longer keep the blood clean and balanced, the body begins to struggle. Toxins that should leave through urine may remain in circulation. Fluid that should be removed may stay in the tissues. Important minerals that need careful balance may become unstable. When kidney failure reaches an advanced stage, the body can no longer maintain life on its own without medical support. That is when treatments like dialysis or even a transplant may become necessary to do the job the kidneys can no longer perform. I'm not telling you this to frighten you, but to help you understand how essential these organs are and why protecting them matters so much. This disease is serious, yes, but understanding it is the first step toward awareness and control. The more you know about how it develops and what it truly means, the more empowered you become to listen to your body carefully and seek help early if something feels wrong. Your kidneys work quietly for you every second. Learning about this condition is a way of returning that care and attention back to them. Now that you understand what this condition really means, let's gently talk about why it happens, because kidney failure does not appear without a story behind it. In most cases, it develops as the result of other health problems that slowly damage the kidneys over time. One of the most common causes is uncontrolled diabetes. When blood sugar stays high for years, it begins to harm the tiny blood vessels inside the kidneys, the very vessels responsible for filtering waste. At first, the damage is silent. You feel normal, but little by little, that constant sugar exposure weakens the filtering system. Another major cause is long-term high blood pressure. Think of blood pressure like water flowing through a hose. If the pressure is too strong for too long, it strains and damages the delicate filters inside the kidneys. Over time, this pressure leaves scars, and scarred tissue cannot filter blood properly. These two conditions alone account for a large number of kidney failure cases worldwide, and many people live with them for years without realizing the impact they are having internally. But it doesn't stop there. Certain infections, especially those that directly affect the kidneys, can lead to sudden damage if not treated quickly. Some people develop kidney problems because of autoimmune diseases, where the body mistakenly attacks its own tissues. In these situations, the kidneys become innocent victims of an overactive immune system. There are also genetic conditions that run in families, meaning some people may be born with a higher risk without knowing it. Long-term use of certain medications, especially painkillers taken in high amounts over many years, can slowly strain the kidneys as well. Even severe dehydration or major blood loss from an accident can cause sudden kidney injury if the organs do not receive enough blood flow. In hospitals, we sometimes see kidney failure develop after serious infections or heart problems, because when the body is under extreme stress, the kidneys are often one of the first organs to suffer. What is important for you to understand is that kidney failure is usually not caused by one single event. It is often the result of ongoing strain, silent damage building up day after day, and because the kidneys are so resilient, they keep working even when partially damaged, which can give a false sense of security. Many patients tell me they felt fine until one day they were told their kidney function had dropped significantly. That is why awareness of underlying health conditions is so critical. If you live with diabetes, high blood pressure, heart disease, or a family history of kidney problems, you are not powerless, but you do need to be vigilant. The earlier we recognize risk, the better chance we have to slow or prevent serious damage. Understanding the causes is not about blame. It is about clarity. It is about recognizing how connected your body systems truly are. When you take care of your blood sugar, your blood pressure, and your overall health, you are also protecting your kidneys quietly in the background, and that knowledge alone can become a powerful step toward safeguarding your future. As this condition develops, the body often tries to send signals, but they are not always loud or obvious, and that is why so many people miss them in the early stages. One of the first things many people notice is a deep, unusual tiredness that doesn't go away with rest. You may wake up feeling as if you never truly slept, or you may find yourself losing energy halfway through the day without any clear reason. This happens because when the kidneys are not working well, waste can begin to build up in the blood, and that can make the whole body feel heavy and drained. Along with this, some people notice changes in their appetite. Food may not feel as appealing as before, or you may feel full very quickly, even after eating small amounts. Over time, this can lead to weakness and a general sense that your body is not as strong as it used to be. Another common change can be in urination patterns. You might find yourself going more often or less often, especially at night. Sometimes the urine may look different, darker or foamier than usual, and while this might seem like a small detail, it can be the body's way of quietly signaling that something is not quite right. Some people begin to notice swelling in their feet, ankles, or around their eyes. This happens because when the kidneys struggle to remove extra fluid, it starts to collect in the body's tissues. At first, this swelling may be very mild and easy to ignore, something you might blame on long days or standing too much, but over time, it can become more noticeable. You may also experience difficulty concentrating or thinking clearly. Many patients describe it as a kind of mental fog where they feel slower or less focused than before. This can be frustrating, especially if you don't understand why it is happening. There can also be a strange sense of discomfort in the body, like restlessness or a feeling that something is off, even if you can't explain it. Some people notice dryness or itching of the skin that seems unusual and persistent. Others may experience shortness of breath or a feeling of heaviness in the chest, especially when fluid begins to affect how the body balances itself. What makes all of this so challenging is that these changes often appear slowly and gently. None of them alone may seem serious at first. You might blame work stress, aging, poor sleep, or daily responsibilities. But when these small signs start to add up, they form a pattern that should not be ignored. Your body speaks in whispers before it ever begins to shout. If you start to notice that your energy is fading, your body feels different, or your normal routine suddenly feels harder to manage, it is worth paying attention. Listening to these early signals and taking them seriously can make a real difference. If something feels unusual or persistent, don't ignore it. Give yourself the care and attention you deserve, and consider speaking with a healthcare professional, because noticing these changes early could help protect your health and your future. When we talk about protecting your kidneys, I want you to think of it as a long-term act of care toward your body, something gentle and steady that becomes part of your daily life. Prevention is not about doing one big thing once. It is about making small, consistent choices that support your health over time. One of the most important steps is learning to take conditions like high blood pressure and high blood sugar seriously. If you have been told you have diabetes or elevated blood pressure, managing them carefully can make a huge difference in protecting your kidneys from damage. This means following your doctor's advice, taking medicines regularly if they are prescribed, and going for routine checkups even when you feel fine. Many people only seek help when they feel unwell, but kidney health often depends on what you do during the years when you feel normal. Staying well hydrated is another simple but powerful habit. Drinking enough water helps your body remove waste naturally and supports the kidneys in doing their job without extra strain. At the same time, it is important not to overuse painkillers or medicines without proper guidance, especially for long periods, because some medications can quietly stress the kidneys if taken too often. Eating in a balanced way also plays a big role. Choosing fresh foods, reducing too much salt, and being mindful about what you eat can help maintain healthy blood pressure and overall body balance. Regular movement, even simple walking each day, supports circulation and helps the body stay strong. These small daily efforts may not feel dramatic, but over time, they protect the organs that work so hard for you. It is also important to pay attention to your body and not ignore changes. If you notice unusual tiredness, swelling, or any persistent discomfort, getting it checked early can prevent bigger problems later. People with a family history of kidney problems should be especially mindful and make regular health tests a part of their routine. Prevention is really about awareness and respect for your body. It is about understanding that even when everything seems fine on the surface, your body is depending on you to make choices that keep it strong. Avoiding smoking, managing stress, and maintaining a healthy weight all support the body in ways that also protect the kidneys. These are not difficult changes, but they require consistency and care. Think of it as an investment in your future, a way of protecting your energy, your independence, and your ability to live the life you want. Your kidneys work quietly for you every single day without asking for attention. The least we can do is support them through mindful living and regular care. If there is one message I want you to carry with you, it is this: small actions taken today can prevent serious problems tomorrow. Start paying attention, start caring for your health, and if you ever feel unsure, don't hesitate to speak with a doctor, because taking that first step could be one of the kindest things you ever do for yourself. When we begin to talk about treatment, I want you to think of it not as a single moment or one medicine that fixes everything, but as a journey of care, support, and adjustment that helps the body continue to function and live as fully as possible. The kind of treatment a person needs often depends on how much the kidneys have been affected and how early the condition has been discovered. In the early stages, the main focus is on slowing down further damage and helping the kidneys continue working for as long as they can. This usually means carefully managing related health conditions, especially diabetes and high blood pressure, because keeping these under control reduces the strain on the kidneys. Doctors may prescribe medicines to help balance blood pressure, control blood sugar, and support the body's natural processes. At the same time, gentle changes in daily life can make a big difference. Adjusting what you eat, being mindful about fluid intake, and attending regular checkups can help the body stay stable and reduce pressure on the kidneys. Many patients are surprised to learn that with proper care, it is sometimes possible to slow the condition and maintain a good quality of life for many years. As the condition becomes more advanced, treatment may need to offer stronger support because the kidneys may no longer be able to clean the blood the way they once did. In such situations, doctors may suggest a process called dialysis. This is a medical treatment that helps remove waste and extra fluid from the blood when the kidneys are not able to do it effectively anymore. It can sound frightening at first, but for many people, it becomes a routine part of life that helps them feel better, more stable, and more energetic. It is a way of giving the body the support it needs to keep going. Some people receive dialysis at a medical center several times a week, while others may be trained to do it at home, depending on what suits their health and lifestyle. Another treatment option for some patients is a kidney transplant, where a healthy kidney from a donor is placed into the body to take over the work that damaged kidneys can no longer do. For many, this offers a chance at a more independent life, though it requires careful preparation and ongoing medical care. What matters most is that treatment is never just about machines or medicine. It is also about emotional strength, support from loved ones, and building a routine that helps you live well despite the condition. Many people continue to work, spend time with family, and enjoy meaningful moments while receiving treatment. Yes, there are challenges, but there is also hope and support at every step. The most important thing is to stay connected with your doctor, attend regular appointments, and speak openly about how you are feeling. The earlier treatment begins, the more options there are, and the better the chances of maintaining comfort and stability. If you or someone you care about is facing this condition, please remember that you are not alone and help is available. Taking that first step toward proper care can protect your future, and sometimes just choosing to learn and seek guidance is the beginning of healing and strength. As we come to the end of this conversation, I want you to take a quiet moment and reflect on everything we've discussed, not with fear, but with awareness and compassion for yourself. Your body is not your enemy. It is not trying to betray you. It is doing its best every single day to protect you, to balance you, to keep you alive in ways you rarely see or think about. And when something begins to go wrong, it does not mean you have failed. It simply means your body needs attention, care, and support. So instead of feeling overwhelmed, I want you to feel empowered. Knowledge is not meant to scare you, it is meant to guide you. If you have recognized even one small sign in yourself while listening to this, don't ignore it, but also don't panic. The next step is simple and calm. Speak with a healthcare professional. Get the right tests. Ask questions. Take control through information. So many serious health problems become much more manageable when they are discovered early. And even in more advanced stages, there are treatments, support systems, and real hope. I have seen patients who were once terrified go on to live meaningful, active lives because they chose to face the situation instead of running from it. That courage begins with awareness. I also want you to remember that caring for your health is not selfish. It is one of the most responsible and loving things you can do, not only for yourself, but for the people who depend on you and care about you. When you protect your health, you protect your ability to be present for your family, your friends, your dreams, and your future. Small daily habits, regular checkups, and listening to your body's quiet signals can truly make a difference. You don't have to change everything overnight. You just have to begin. Even one positive step today is better than waiting for tomorrow. If this message has resonated with you, let it be a gentle push toward action. Schedule that checkup you've been postponing. Talk openly about your health. Share this information with someone you love who might need to hear it. The goal is not fear. The goal is awareness, prevention, and early care. Your body works for you every second without complaint. Give it the respect and attention it deserves. And remember, you are not alone in this journey. There is help, there is guidance, and there is always hope when you choose to listen and act.